and their ongoing connection to culture and country. We acknowledge First Nation peoples as the traditional owners, custodians, and lawkeepers of the world's oldest living culture and pay respects to their elders, past, present, and emerging, whether that be on the land I'm sitting on here in Paran or where you are listening to this seminar. So I am a professor in the department, and I also run the Master of Public Health. My background as a researcher is diabetes epidemiology, and I've done that for 20 years. And I do that at Baker, which Heart and Diabetes, which is sitting on the same campus as the School of Public Health and Preventative Medicine, which runs the Master of Public Health. Okay, so I guess I want to start with why bother to study public health? And I think I've been helped along the way with this, because I don't think we have to look very far or very deeply to answer this question. We just have to look around and see what's happened at the population level recently. We've seen bushfires, and I'm sure we'll see them again this summer. We've had COVID, we've had floods, and even last night we've got more damaging storms, and all these episodes of weather, for example, and COVID have an effect on health. We've also seen changing population demographics. We've changed our diets over the last 30 years. We've changed our jobs, and we've seen massive epidemics of diabetes and obesity. And more recently, and surprisingly, we've now got an epidemic of vaping. And we need to know what this means for populations and how to manage these and what they mean for long-term health. So now I'm going to talk about, well, why study this at Monash? Well, Monash gives you incredible research opportunities. You have the chance to work with networks and learn from researchers across the whole Alfred precinct, which includes Alfred Health, Baker, the Burnett. We've got a Department of La Trobe. And independent of that, we have doctors at the Alfred who teach with us. You have me, I teach, but I work as an epidemiologist, but I work at Monash. So you have real life teachers who work in the space. We have a very strong legacy. We were the first university to offer the MPH in Victoria, and we've got a really strong program. We're also one of the largest schools of public health in the Asia Pacific regions. We have great rankings. And as I mentioned before, many of our lecturers are clinical researchers, and we have the real world experience that we add to our curriculum. Obviously, we get along very well, and we have a very collegial atmosphere, and we really try to make the courses very flexible and provide you flexible study options with busy working professionals in mind. Okay, this is just a schematic of our school and the areas we have expertise in. We have a group in health policy, law, and advocacy. We've run one of the biggest trials in Australia called the Esprit trial, which is now in a follow-up phase, an open follow-up phase. We've done population studies. We've got a Department of Global Health. We've got some genomics. We do health program implementation and evaluation. We are the strongest school in occupational health and safety in Australia. We have a very strong health service management, and our climate, health and change is really building. And we also have a great footprint in clinical registries and biobanks. Okay, this is the course structure. So you can do a 3-year master's or a 2-year master's, and what you do and which one you enroll in depending on where you are in your own educational journey. If you just have an undergraduate degree, which is a non-related discipline, we would invite you into the 96-point masters, bearing in mind that each unit is 6 points, and that will be 2 years full-time, 4 years part-time. And if you're got an undergraduate degree and in a related discipline like public health or health sciences, and you work in an area that I deem relevant to public health, you only need to do 72 points. So that's quite fewer units. And then if you're a medical doctor, have done a PhD, you only have to do 8 units. And we organise our subjects into 3 parts. The first part of units, they expand the public health knowledge and giving you the public health fundamentals. And then we broaden that out with core units in part B. And then we have part C, which give you some opportunities for specialised electives, a research program, or even a practicum unit. Now, if you've come from a Monash, we have, I'm just trying to move my screen over. Yeah. If you come from Monash, we have special 72 credit point pathways. So if you come from the Bachelor of Biomedical Science degree, you can get, you can come in at 72 points and not do the 96, but you need to have completed 36 credit points of specific units, and those are the numbers there. And you need 2 units from the next list. And if you want to do that, contact our postgraduate office and they will advise on this more closely. We also have some pathways for the Bachelor of Health Sciences if they complete students who complete certain electives, and the Bachelor of Health, Public Health students have a direct pathway into the 72 credit point masters, because obviously they do a lot of that, a lot of kind of relevant subjects in their undergraduate degree. Okay, so what we have introduced probably in the last 5 years is you not only get an MPH from Monash, you can get an MPH with a specialisation, and we are currently offering 1, 2, 3, 4. I think it's 6 specializations, but we might broaden that at some stage. So these will include currently epidemiology, global health, health economics, health policy, health promotion, and then you can do research. Now, to do a specialization, and this will mean you'll get a degree, MPH in brackets epidemiology, or MPH in brackets health promotion. This means you'll get that kind of degree, but we will specify mostly which subjects to take. So, for example, for the MPH epidemiology specialization, here are the core units. So you have to do these 4, 5 core units on the left. And then we also suggest you do these other epidemiology units here. And then the last one is I think we fill one elective or maybe 2 electives, depending on whether you're coming in at 72 or 96, where you can choose to fill up the rest of your degree with other subjects. Now, you don't have to do a specialization. You can just do MPH, which is just picking subjects at your own will, as long as you do the core subjects. So you have a choice there. You can also do research. Okay, so what will we teach you? Well, we'll teach you how to basically analyze and interpret data. We'll give you a graph and you'll have to understand what that graph means. We'll teach you how to read the literature and how to understand the studies that we use to find things out in science. We'll teach you how to apply public health knowledge and skills to the various public health challenges, like how do you deal with an epidemic, for example. We'll teach you some leadership and management skills and how to operate in the health sector. We'll teach you how to communicate public health concepts to the public, to colleagues, and to other academics. And if you're into health promotion, we'll teach you how to design, implement, and evaluate a public health program. We have a strong health economics group, and they will teach you how to do health economics. And we'll also teach you how to design and analyze public health policy. So you can see they cover all our different specializations. What we're really known for and what we're really proud of is we try to teach students in a way, and towards the end of their degree, we offer them some on-the-job training if they would like to take it. And we call this the Public Health Practicum unit. It's a fairly new unit. I introduced it in 2020 and it's going strong. And it's an industry placement unit which is conducted in the workplace, and it gives you hands-on experience and teaches you how to be ready for a job. And one of my students here today, one of my workers here today, I should say, was a student and did this with the dietitians and the diabetes educators at the Baker. So we ask you to come into a organisation for about 20 hours a week. You get treated like an employee. This subject is worth 2 units. It's a capstone unit. And you work as you would in a normal working environment, but you have your own little project. And you learn, it involves work integrated learning, and it's a really enjoyable unit. The type of placement is really flexible. We've had data analytical projects, we've had health promotion projects, we've had projects in council, like local council, and projects in the Cancer Council, for example. And we really try to get students to say, look, I want to work in vaping. So I want to understand vaping, do a research project in that, or I want to do a health promotion project in that. So then together we'll go and contact people who are working in vaping. So it's a really fun thing. I just want to mention that it's highly competitive. We have about 7 students a semester, and there's certain academic thresholds which must be met, but it's lots of fun. And I've two of my students in the last 5 years have got jobs from it. So that's pretty exciting. Okay, so what I get asked all the time is, what can I do with my MPH? Well, after COVID, jobs are really in demand. Job prospects are really good for MPH graduates, and the better your marks are, the better chance you're going to it is when you'll get a job. You can work at a university, Department of Health, local council, non-government organisations like Kidney Health Australia, Heart Foundation, Diabetes Australia. You can work for the pharmaceutical industries, Pfizer, Sanofi, or we've had students who got jobs at Medibank Private. And the titles of the jobs you look for in SEEK are research officer, project officer, health promotion officer, epidemiologist, study officer, data scientist, environmental health officer if you do the occupational health masters, health promotion officer, and research associate. So in my department at Baker, almost everyone's got a Master of Public Health or a PhD in epidemiology. Now I'm going to give you some examples of students who have done really well with us and got, and I just want to talk about their path. So we have Sally Hartmanis, and she did her MPH in 2017. And she did a health economics specializations, and then she applied her knowledge to health economics around the genome sequencing at the Centre of Population Genomics. And now she is undertaking a PhD at Oxford, a premier organisation in the world. And then we have Sophie, who's here today, who will you can ask questions to after this. She commenced her MPH in 2022, and she did a MPH with a specialisation in epidemiology, and she did mainly epidemiology, but also was interested in health promotion. And then she came to Baker, and she didn't work with me then, but she worked with the diabetes educators and diabetes and the dietitians, contributing to developing health promotion initiatives. But then she applied I had a job as a research assistant running my study called Prediction, and she applied for the job and she's got it. And I think she's learned a lot in it already. We can go to Sophie in a minute, but I'll just tell you about some new entry pathways that we've released last year. We have a graduate certificates, which are now 4 units: epidemiology, public health, health promotion. And then after you've done those 4 units, you can go into the Masters of Public Health. So it gives you a taste without a big financial commitment. We prescribe these subjects generally. And then we've just also introduced professional certificates in public health and epidemiology. And here you do 2 units. So it's only 2 subjects. So you really just get a little bit of a taste, and then you can decide whether this whole area is a good fit for you, because it is a financial commitment. And I just want to say that it's really important for me to always update the electives, so I'm meeting the market. So in 2023, we introduced 2 health economic subjects, And then in 2024, we had a subject called Social Media and Health Promotion, which I think is really, really exciting. And we've got this subject that's run from another master's, but it's available for us, Health Data Analytics, and you can just imagine how important that is with data everywhere. And Culture, Society and Public Health. So that's the role of socioeconomic status in health and planetary health. And the last thing I'll say is we have a new master's in data analytics, and that offers some interesting subjects for the very numerate student. And those students can do some electives with me, and my students can do some electives with that master's. So, and some of the calls are matching. It's quite a difficult master's this one, but it's also really good if you're that way inclined. And I'll stop it there and unstop sharing, and I'll ask you to ask some questions. And maybe Sophie, if you want to ask Sophie, who's the student who's finished her master's and working with me, you're welcome to.
Well, I'll say a little bit about my experience if people would like to hear that. So I studied undergraduate. I did a double degree in law and science at Monash, and I majored in immunology. And I decided I didn't want to practice in law, and I wanted to do something more in the health area. So that's how I came across the Masters of Public Health. And I thought, oh, this is a bit of a big commitment, especially because it's full fee. So it is quite a lot of money, but I think it's really worth it. I think the 2 years that I spent studying at Monash doing the Masters, I was a lot more, I learned so much more than I did in, say, the 6 years I did my undergraduate degrees. I originally said I was going to specialize in health promotion, but then I did a few of my units were in epidemiology, and I've always really enjoyed stats and the analytical side of science. So then I decided to change my specialization over to epi, but I also did a lot of health promotion units. So there is the option, if you have a couple of interests, you can choose your electives in more one area. Otherwise, you can choose to spread them across a whole lot of areas. So I did in health promotion, just looking at my units, so there's a subject about designing health promotion programs. You can also do a unit that's basically the foundations of health promotion. And then say in epi, one of the units I really enjoyed was infectious diseases epidemiology, and it can be a little bit difficult at times, but it's so worth it once you learn the content, and it's all really applicable to your job. Like, I'm using so much of the information that I learned in my degree in my job now, and especially like take all the opportunities you can to use the software that is available. Say Stata and REDCap will get mentioned a lot during the degree. If you can learn how to use that, it's really helpful later in your career to be able to know how to come into a job and be able to use those applications. And then in terms of contact hours at uni, so when I started it, there was only really the option as on campus or online, but I think there's more the multimodal version as well now. But for the on campus, a lot of my lectures were still online, so I could watch them from home and they were recorded. So that made it a lot easier to be able to do work while I was studying. But the thing with the timetabling for the units is a lot of them they have what are called block days. So you're required to come in, say, 2-3 days of the semester where you're there for the whole day learning content. And you don't get to choose what days they're on. They're just set in a calendar, but you do get told in advance. So you can normally plan your work hours around them. So I find that I was still able to easily work 3 days a week while I was doing that. While I was doing the practicum unit, while I was working 3 days a week at Baker, I did have to reduce my hours, but where I was working, they're very understandable, and you can work after hours after uni if you wanted to. But I think it's really flexible, and you can really easily work while you study. And yeah, I think I'm happy to answer questions about the practical unit too, if anyone has any questions.
Any questions for Sophie?
If nobody's got a question, it's Kirsten. I'd be interested in just hearing a little bit about how, because obviously doing a master's gives you a lot of skills and knowledge, but what are the kind of the so-called soft skills that doing a master's will give you that might make you more employable and give you a competitive edge over some of
that's a really good
peers?
question. I think a lot, because in the block days, a lot of them, if you're classified as on campus, you're asked to come in, and we do a lot of group work. So being able to work in a team and to be able to solve the problems that you're given by your lecturer, that you learn how to work with people that you've never met before, to be able to overcome problems. Especially in my practicum unit, I gained a whole heap of soft skills to be able to I guess, communicate with stakeholders that I've never met before over email, in person, to be able to manage a whole project. Like, I was given a lot of responsibility in my project. So I was basically, my supervisor said, we need to introduce an active living program at Baker. These are the kind of things we want to include in it. Here you go, find something. And then I was given about 12 weeks to try and figure out how we could do that. And I had to manage and implement that. So that it was a lot of organization, time management, and just being on the ground and learning how things work in a workplace is really valuable experience. And it's like, you can read as much as you can during your degree, but working in a workplace doing that kind of stuff is just going to be so much more valuable.
Thank you for that. Does anyone else have any questions?
All right, well, perhaps I'll hand over to Danijela.
Hello, everyone, and welcome to this session, and thank you for taking time to be with us tonight and learn more about Master of Public Health and Master of Clinical Research. I would like to present as a course coordinator of Master of Clinical Research with my colleague, Dr. Mark Habgood. I would like to present you more about this particular course. I am an associate professor in epidemiology and chronic disease prevention, and also a medical doctor by training. And the passion about clinical research started very early, right? Starting from my training to become a doctor. But later, I was really passionate about how you actually, how you get to that evidence-based practice and how do you create that evidence in clinical research. So if your passion is in clinical research, then this is the right course for you. And before I even present how the course structure looks like, I would like to start actually from where this Master of Clinical Research will take you. And this is big thanks to my colleague, Dr. Mark Habgood, for this wonderful slide. He and I were talking about what are the possible jobs where all our master students ended up in. And we put together this wonderful slide. He put together this wonderful slide. And I just wanted to show you that you may be now at this point, so either finished your biomedical degree or a public health degree, or maybe medical degree or nursing degree or any health professions degree or science degree. And now you really want to see what is the next step. And oftentimes my students ask me, once they are close to finishing their degree, they're asking me, okay, what can we do with this degree? And I would like you to think differently. I would like you to start from where this degree can take me and to see whether this degree is right for you. So if you're passionate about clinical research, if you're passionate about improving quality of care, if you're interested in developing knowledge on how developing knowledge that can improve human health, or if you want to learn about study design or to learn about the studies related to safety and effectiveness, whether medications, whether those be devices, vaccines, or any medical procedures, this is the right course for you. Or you simply want to improve your knowledge about conditions, so this is the course for you too. Or how to improve quality of life in patients, or how to start with behavioral change with participants, or applying new behavioral change techniques. If you're interested in developing new diagnostic methods and new treatments, this is the right course. Monash, our school, Diana presented already how our school is advanced on so many levels, but I would like to mention something related to clinical research that is so unique to our School of Public Health and Preventive Medicine, is that we have probably over 40 registries. And this is crucial for advancing and improving quality of care. So if your interest is analyzing data and providing evidence that can be implemented and like a benchmarking in healthcare, this is the right course for you. And if you have a look at this slide, what you can see here is that we have various places where this degree can take you. And some of these places, as you can see, potentially overlap with what Diana was mentioning. But that just tells you how transferable skills that you will gain through this degree are, that you can branch out and actually work in various jobs. And if you have a look at here, we are talking about drug industry, biotechnology, medical devices, but also Department of Health in a hospital. But don't forget about teaching, because my passion started from treating, patients working in healthcare. Then it branched out towards doing research myself, and now it continues to the very days. But also developed the passion of teaching, so I can help new generations learn about clinical research. And the majority, oftentimes people think that the majority of people who are enrolling in clinical research are health professionals. Yes, there are many health professionals who are enrolling in Master of Clinical Research. However, there are people from other degrees, as you can see, biomedical and science, and many other. We had people from engineering also. And if you have a look at these circles, that just shows you really almost like a big careers that you can branch into. But underneath each of these umbrellas, if you want to call them that way, there are so many jobs. And there are so many jobs underneath these ones. So you can work in a manager role, or you can go directly your hands onto research, onto clinical research. But regardless of any of the jobs you have, by learning and by going through all the by learning over the course of the Master of Clinical Research, you will gain essential skills and essential knowledge that will help you actually excel in any of the jobs that you decide to go to or to choose. So actually, I'd just like to go back quickly, because I would like to say that this particular course is unique in having two specializations that start actually from the get-go. As soon as you enroll into this program, you can choose going into translational research or going into clinical research specialization. We have some overlap in the first year, so just in case you change your mind and you decide that thinking from bench to bedside, the more you go closer to the bench, it is translational research, the more you go closer to the bedside, it moves more into clinical research. But if you change your mind and you're more passionate about the bench side and say, I would like to go into translational medicine, or the other way around, you say, I'm more passionate about clinical research, then it is possible. There is some flexibility to change that in your first year. So I will let you know about how our course looks like for a clinical research specialization, and then Mark will share with you how that looks like for translational medicine specialization. I already mentioned that in clinical research, we do conduct studies, we design studies. And in order to conduct study, it is essential to learn about the research methods. It is essential to learn about ethics and good research practice, because we cannot really move without that. So I'm sitting on Alfred, a Human Research Ethics Committee, and we get so many clinical research studies on a monthly basis to review and to evaluate, are they ethically sound and are they safe for our patients? And each patient or each participant has to sign a consent form. So it is essential to learn about ethics in clinical research. Whenever we start from something, we start from reviewing the evidence, and it is essential to know how to systematically review evidence and meta-analyze the data. And once we actually when we are designing the study, then we have a specific one inherent in clinical research. We do a lot of clinical trials, and there is a specific unit dedicated to clinical trials. And I would just like to say, considering that clinical trials are like ever-growing area, we now started also, we are starting soon with, and because of huge interest, we are starting graduate certificate and graduate diploma in clinical research too. So you will learn about that one soon. It'll come out in our handbook. So once you actually have all of it there, so you learn how to design, you learn how to do the study, and what do you do once you get the data? So now you need to analyze those data, provide the reports, inform clinicians, inform clinical practice about the best practice or whatever results you've gotten. And for that, you need essential skills in epidemiology and biostatistics. You need to how manage the data, practical data management, but also you need some more sophisticated techniques to analyze such data. And that's why we have these regression methods for epidemiology. And a crown on all of it is your practical part, because once you learn all the how-to things, now you can implement them in your own research project that spans over a full year. And the uniqueness of that project is that now in the first part, and that's called research in advanced health professional practice, you learn how to, you're applying your knowledge in systematic literature reviews, you're thinking about ethics, how the ethics proposal is made for any of the studies, you're thinking about the methodology, about the proper design. And colleagues, design is essential, because if the study is not properly designed, there are no sophisticated statistical techniques that can help you. So designing the study is imperative, and everything else comes after. Once you do that part, then in the second part of your kind of research journey comes advanced health practice research project, when you actually have hands-on data, and when you learn how to analyze data in our preferred packages are often Stata and R, but there are many others like SAS and SPSS that people use. You will learn how to analyze the data using any of those statistical packages. You will learn how to interpret data. You will learn how to report data. So those are all essential skills that are necessary. And what is really good is that if you are interested in continuing your journey in a research space, then you can use this as a leverage. So these 24 credit points, you can use that as a leverage to enroll into a PhD, into a PhD or a doctoral degree, pending that you meet also other requirements. As you can see here, there are several electives, so we give some flexibility to this course. And why I'm saying this is that these electives can actually help you. Like if you're passionate in doing your research in chronic disease, then in chronic non-communicable diseases, you may wish to take that unit as an elective. If your passion lies in infectious diseases or communicable diseases, you can choose that unit. Or you would want to actually work on your, like if your passion lies in patient-reported outcomes or any other research that requires qualitative collection of qualitative data and designing qualitative research study, we have an excellent course. We have an excellent unit that is related to qualitative research. So we give you opportunities to build on the skills that we already kind of help you build through the course, but also through the choice or like really where your passion lies. What is really excellent is where School of Public Health and Preventive Medicine is, as Di mentioned. So we are in the Alfred precinct. So that's Alfred Hospital. We have a lot of registries. That's really a gold mine of data. And now biobanks. So it is a fantastic position of the school, and the top clinical researchers actually work in our school too. what is really what I would suggest is while you're in medical degree, while you're in your clinical research specialization or translational medicine specialization, in this particular research path, ensure during this year, ensure that you also publish your wonderful research, that it just doesn't stay on the shelf, because having publications will also make you more competitive when applying for jobs. So I would just ask my colleague Mark Habgood to now talk a little bit more about translational medicine specialization, and then he and I will be more than happy to answer any questions you may have.
Thanks, Danijela. So I'm Dr. Mark Habgood. I'm working in the School of Translational Medicine, and I'm looking from the academic research side as my background. And my interests are particularly in blood-brain barriers, access to drugs to treat CNS disorders, but also more recently, access of drugs into the fetus during development, because a lot of the medications that we have never been tested in pregnant women for ethical reasons. And it's simply not known how much of that can reach the fetal brain and what it does. So I'm looking more from the academic research side. And the translational medicine, this is research that is clinically orientated, where it has the potential to be developed into something, an application that can help or improve the healthcare of patients. And it's lots of innovative ideas and research findings that come out of academic research. Also, a lot of ideas come from the stuff that Danijela's been talking about, particularly epidemiological studies, where associations studies and the patient data can identify key areas of interest for research to identify mechanisms, disease mechanisms, potential targets to intervene at. And you can then develop strategies for intervening in those targets. Could be the development of new drug candidates, new treatment options. It could be cellular based, it could be genetic based, or it could be biochemical based. But also, during your research, you can come up with new ways of doing things. You may find new biomarkers for a disease. These things are very valuable to the drug industry because they're ways of measuring the effectiveness of their drug candidates. And they all have potential to help get patient outcomes at the end of the day. And so I've started over here that a lot of the research innovative findings, part of the course, the translational medicine, is how to identify aspects of research that actually are translatable. Once you have something that you think you want to translate, you need to develop that into a lead or a prototype that is suitable to be put into a human for testing. And I've noted on here that this takes a lot of money. And I'll come back to that in a minute. And then having got your lead and prototype developed, you then need to get that tested for safety and efficacy in humans before you can apply to have it registered as a treatment that can be used clinically to treat patients. And even though I've shown it here as a one-way arrow from bench to bedside, really, this is the area that it starts at. If what you've found doesn't fit a significant clinical need, it's never going to be used. If it's not going to be used by patients, if the cost is out of the range or the side effects, the benefit side effects equation, it's not going to be taken by people. And so part of the course that we're concentrating on here is knowing all of the different steps and the key stakeholders to get from a research finding to an application. And the motivations of the people along the way are quite different. And you need to learn to speak the language. To develop a lead, you need money. You have to be able to convince people the significance of research and its potential to people who've got a lot of money that they're willing to invest in it. Then you need to be talking to clinicians for clinical trial testing. You also need to be able to express the significance to the lay public, to patients, families, carers, and also to the general public and politicians, that it is a significant area to support. And the units that we've got in, I'll get Danijela to switch to the next slide. So in the translational medicine stream, or it should be a specialization really, it focuses on the 2 years. In the first year, we have a number of units to give you the skills and the foundational knowledge to support you in the second year. And the second year of the translational medicine specialization is you conduct a research project. And this is a full year project. It can be laboratory based or it can be clinically based. And you're undertaking a novel research project. You're doing the experimentation, you're getting the results, you're analyzing them, the conclusions, and you're generating a thesis which will be submitted. To underpin that, we have some, this is TRIM 5008, we have a unit where you can choose within that unit which particular area and disease that you're most interested in, maybe in neuroscience, metabolic disorders, diabetes, glucose control, hematology, or immunology. And from within there, we supply with the foundational knowledge about the disease processes, but also the current translational aspects. Which are the translational pathways available there? Where are the gaps in knowledge? So that you've got something upon which you can then choose the topic of your research project. We also have some research methods in there that upskill you to help you with the research project. Some of the other units we have on the way, and this one relates particularly to this one, when you're taking an idea and trying to develop into something that can be put into a clinical trial, you need money to translate it, and you need to be able to attract investors. You won't be able to get the money from grant funding or from universities. They simply don't have it. You need the money from investors. The translation pathways that you can use, we go through those. They can be either forming a startup company. So you're adding value with the intellectual property you generated. You can spin that out into a startup company, or you may license it directly to an existing pharma company. And a lot of the teaching in here also includes the soft skills that you're going to require. You learn how to recognize the language you need to speak to investors is quite different from what you need to speak to clinicians. They want to know if they invest money, will they get a return on that money? So we have a section in there on teamwork and leadership skills to build your reputation and profiles. We also have a clinical trials unit that we put in here, and this is a different style of clinical trials unit to the other ones available. This is more practical based. So in this unit, we're getting the students to look at all the different stakeholder perspectives for clinical trials. So we actually place you within an active clinical trial, and you shadow the coordinator to learn what's actually involved in coordinating and running a clinical trial in patients. And you also get the patient's perspective from within that clinical trial as well. We get you also to design your own clinical trial, and this is done as a group activity where you need to work together as a group to design a phase 1 or a phase 3 clinical trial and present that. And this gives you the academic researcher's perspective. We also give you the clinical trial proposal for a real clinical trial, and we put you in the position of the Human Ethics Review Board, which is where Danijela sits on. And from this, you assess the clinical trial proposal that you've got and come up with a recommendation as to whether you feel this is safe to be put into humans. And the idea behind this is that when you're doing your research and you're going on in your postdoctoral career, you may be putting together clinical trial applications, and knowing how they are ethically reviewed, how they are actually run, makes it a lot easier for you to make a better application to get that funded for. And I've also put on here the epidemiology as well. This is crucial for a lot of this translational pathway, because a lot of the observations, the outcomes and findings from the epidemiological studies feed back into the academic research, the focus for the research, and also the significance of it. To get your idea from the bench to the bedside, you have to show there is a clear translation pathway, and each stakeholder along the way has to appreciate and really see the significance and value of that on the way. And I'll probably stop there if there's any questions that people have. And if not, I'll pass you on to Yvonne. So Yvonne's a master's student that did the Master of Clinical Research with us. She's in her second year this year, and just earlier today, she submitted her thesis at the completion of her second year. So she has seen the first year, the whole course from beginning to the end. So she will be able to answer many of your questions if you have them. So Yvonne, how was it?
Thank you, Mark. So yes, just a bit of a background about me. I'm a medical doctor by profession from the Philippines. Back then, I did general practice and pathology in my home country, but even before my medical career, I was already very passionate with research. And even then, when I badly wanted to get into the research field, the opportunities and facilities were just not available in my home country. And so I tried to enroll in Monash Uni, being it one of the top universities worldwide when it comes to research. And now I'm here doing a master's in clinical research, specializing in translational medicine. And what I like about doing my master's degree here is that given the vast field of clinical research, I just like how the curriculum addresses several aspects of clinical research, ranging from biostatistics, ethics, epidemiology, translational medicine, and even with the basic sciences. So like in my research here, we were given the freedom to choose which research project to join. And for me, I was really interested with anything that has to do with behavioral or neuroscience, as well as diabetic complications. And so eventually I landed on a project with diabetic complications. And in my research here, I have worked on a molecule that functions to resolve inflammation that could possibly be used as a treatment for diabetic kidney disease and atherosclerosis. And I've always said during my time here in Monash Uni that I couldn't imagine myself anywhere else doing something different. So I have really enjoyed the opportunity of learning with this program, and also our coordinators and supervisors are really helpful and very hands-on, like you're guided every step of the way. And if you ask me what I want to do after this, well, there's a lot, but definitely one of those is to apply for a PhD. Fingers crossed I get through the application successfully. And hopefully in the future, I'd be able to conduct my own clinical trials. Yeah.
Thanks, Yvonne.
Thanks, Yvonne. Now we will move on to answering the questions that have come through the chat. If I could get Danijela and Dianna to just unmute yourselves and switch on your cameras.
Actually, sorry. Sherry, this is
Yes.
Kirsten. I'm
Okay.
just interested in something from Yvonne, actually. Yvonne, nice to meet you again. We met at the World Health Summit earlier this year.
Yep.
I'm really interested, just because quite often I think people who are interested in public health think of the Master of Public Health as their go-to course. So I'm really intrigued by the decision-making process for you that led you towards a Master in Clinical Research. Yeah, if you're able to sort of elaborate on that a bit, I think that'd be wonderful.
Yeah. So as to why I chose clinical research is because, well, I want to be a clinician researcher actually. And initially I also, I had plans of going into the drug industry. And so knowing clinical trials and the different phases of clinical trials, that's really one factor that I have considered as to why I chose it over public health, although I do have a background in public health as well. So yeah.
Thank you so much for that. And I just want to say to everyone that's on here, personally, thank you for coming. This is a wonderful opportunity to have all these facilitators in the same place at the same time. So I strongly encourage you, if you do have any questions, ask them now in the chat. It's, yeah, like I said, it's a fantastic opportunity. And if you have a question, I'm sure someone else on here will have exactly the same questions.
I might answer the question about what is the chance of doing a PhD after completing an MPH. Well, the rules from Monash is you need a good GPA and to get a scholarship. And that's the only way you can do a PhD at Monash. You need to have at least one first authored paper in a Q1 journal, preferably 2. So good GPA, maybe even some research experience, and 1, if not 2, first authored papers in Q1 journals. That's quality, the top quartile of quality journals.
I would just, oh, sorry, you go ahead.
I was going to say the application timeline for a full-time MPH program. I'm not sure what that means. Do you mean, I think you can apply now. Is that what the question was?
To submit, recommend suggestions and tips to submit a strong application to enhance the chance of getting the MPH admission. Oh no, for the doctoral program. What's my chance?
No, I've done the doctoral program one.
After completing MPH.
Yeah, I've done that one. But to get into the MPH admission, you just need to have a WAM, a weighted average mean of over 60. And the right degree. So, and some research trainings. But if you don't have the research training, you'll have to do 96 units. If you do have research or relevant experience and a degree which aligns with public health, and a weighted average mean of greater than 60 and meet the English requirements, you would be likely offered a place.
Diana, there's kind of an interesting question on there that I think has been partly answered, but someone's just asked, what's the benefits of doing coursework versus research?
So it depends what you want to do. Research isn't for everyone. It's intensive, but if you like it, you can thrive. So you can just fill your 96 or your 72 credit points with units, okay? And you might make them all epidemiology or all health promotion, and you might have a specialization. Or you do the first half of the degree, and then in the last year, you can do some research. And we have 2 research units. We have one, which is where you write a proposal and a literature review. And then we have a follow-on unit where whatever the project is that you write the proposal and the literature review on, then you go and do that study. And it's like a honours year when you do both of those. It's fairly intensive. There's a threshold requirement, so you need to get over 65, approaching 70 in at least the core subjects. And you can do that research. And at the end, you can write a report, or some people go on to write a paper, and that becomes their paper they use to apply to their PhD, for their PhD.
Thanks for that. There's another question on there that I think is kind of interesting. Someone's just asked about the research projects that are conducted within Monash. They said, are the research projects conducted within Monash, or are we expected to contact other institutions to set that up? It's been answered as, yes, they are all within the school. But what's the process like to identify and then, you know, be selected for a project? Are they given a list, or is there?
Oh, so we have a site on the Monash wide web of Monash called Supervisor Connect, and supervisors and academics within all of Monash. And we'd probably allow you to do a project outside our school if you want to do in a sort of related school, but not actually our school anyway, as long as it's scientific. Supervisors, professors like myself will put a project up and say, I've got this project. It's a master's level, it's an honours level, it's a 1 year, it's a PhD level, 3-year project. This is what it's about. Come and visit me, send me an email. That's how you find your projects.
No worries. So it's almost
like
matchmaking.
Kirsten, to that, we also have a unit coordinator for that particular research placement unit. And with conversation with our unit coordinator, you can also state where your passion lies and what are the particular themes or topics you're interested in researching, and oftentimes we help you connect you with a particular supervisor. So Supervisor Connect is one way. but you can also chat if you are kind of still struggling and navigating that web page and thinking, where should I go? Sometimes it is maybe best even to start and speaking with the unit coordinator, and they can potentially connect you with a researcher that is working on a research of your interest.
Thanks, Danijela. I'm just going to quickly jump in here, given that I've got you on the screen. And we do have a student asking about backgrounds eligible for the Master of Clinical Research. In specific, the student has completed a
Biotechnology.
biotech degree.
Yes, I'm just reading.
Yeah.
Yes, the eligibility, that particular student would be eligible from biotechnology. From Bachelor in Biotechnology, they would be eligible for Master of Clinical Research. And oftentimes, students with biotech background, they lean towards translational medicine specializations, and Mark can attest to that. That many of the students with biotech background prefer and really love and enjoy translational medicine specialization, because it's a lovely continuation of their work and their study.
Yes, we're looking into actually including industry-based projects in the future in part of the translational medicine research stream, the specialization. So biotechnology, yes, would definitely fit into that process.
All right, thanks, Mark. We do have another question, which perhaps Diana,
Yeah.
Mark, or Danijela could jump in on. So we do have a current public health student who is at an undergrad level, currently doing research and industry placement, but isn't too sure if they would like to do a health promotion or advocacy or research as a result. So would they be better off doing the Masters of Public Health or the Masters of Clinical Research, given that background in public health?
It depends what they want to do. They'd be fine for the public health.
It really is what we started from the beginning and saying, like, where your passion lies. Where do you see yourself working in the future? Is it in the space of clinical research, or it's more like public health? And that will kind of drive your decision where to go, but you would be definitely eligible to go to enroll in either of these courses.
I can just add that if they decided that they wanted to do a couple of like health promotion units, you wouldn't be able to do that in the clinical research degree, whereas in public health you can still do research, but then potentially do a couple of health promotion units as well.
All right, thank you. We do have another question from a student who is currently a biomedical sciences student, but
Yeah, I
currently
can
doing
answer
their
that,
honors here.
Shui.
Yes, thank you.
So because you have an honours degree, you would go into the 72-point masters, and you won't, and that's how you get your credits for the MPH. I'm not really sure about clinical research.
It would be the same. For
It would
clinical
be the same because they're the same eligibility criteria.
All right, thank you. All right, so we do have another question. It's in regards to the course plan. So how many hours per week are students expected to be on campus, or rather the Alfred, for the Master of Public Health?
Can I get Maria or Almeida to answer that one?
Well, a full-time enrolment is 4 units per semester, and we would always say to students that they need to allow at least 10 hours per unit per week. So, of course, that varies per student and per unit, but roughly 10 hours per unit, so that's 40 hours a week.
That's of total study time. So the hours that you need to come in will depend on the timetable. For example, epidemiology is an hour lecture and an hour shoot every week.
No, sorry. EPI is like 2 hours workshop weekly.
Yeah.
Yes, and it will.
And stats?
As well, stats is having having actually tutorials and lectures together. But similar, I would just like to mention, because Maida already mentioned it is true, so 10 to 12 hours is per unit. per week, and you have 4 per semester. But I would just like to mention that for international students, although we have options online and multimodal and face-to-face or on campus, for international students, due to visa requirements, they're required to take on campus predominantly, their units on campus predominantly.
All right, thank you, Danijela and Diana. Just one more question that I've received on my end. So it's in regards to the Master of Public Health. It's in regards to placements. So will students be able to find their own placements and then choose to do their time with a company that they've selected for work experience?
We have a list of organized placements, and we have a list of organizations which partner with us to give placements. But if you find your own and it's within our broader remit, we'll approve it and we'll do the contracts really quickly to make sure you're covered, and I'll talk to your supervisor, and it'll be, yeah.
Would
all
this
systems go.
apply if the organization is overseas?
I've done that once before, so yeah, maybe.
All right, perfect. Thank you. Perhaps before we wrap up, if Sophie or Yvonne would like to share, further tips on, what makes a good student in your particular field, for future students that are considering the public health or clinical research as a postgrad study area, that would be great. Perhaps Sophie, do you want to go first?
I would just say really choose the units based on what your interests are and what you're passionate about, because you won't be interested and you won't do well in units that you are bored with. Say, I did take a unit in health policy because I thought I would enjoy that from my law background, and then I really didn't enjoy it. So that's why I changed 2 more epi subjects. And then I found I did really well because I really enjoyed it and didn't feel like work and study. Like I got through the 10 hours a week easily, and really make the time to contact your lecturers and speak to them in person if you are struggling, because they're really personable, and like it's a small cohort, so they're more than happy to help you out. And if you are eligible to apply for disability support services, like definitely do that, because it's really helpful to have that if you need it, especially during assessment time. Like don't feel bad about having to do that, because I know like my lecturers were always really understanding because I have chronic illness, that like when I needed extra time, they were more than happy to help.
That's such a great point I think you made. Sometimes I think like an MPH, particularly a broad degree like that, is just as much an opportunity to figure out what you don't enjoy as it is what you do enjoy. And I guess the lecturers and of course facilitators are there to help you work through that.
Yeah, definitely. And that's a good thing about the MPH as well, as there's such a broad spectrum of units that you can choose within the electives, that you kind of get a taste of everything in your first year, because you are required to do certain types of units that teach you the fundamentals, but then you can then branch out and decide where you want to specialize.
Thanks, Sophie. Yvonne, on to you before we wrap the session up.
Yes. So yeah, I totally agree with what Sophie said as well. But just to add to that, I guess one tip that I can give is that you should know how to manage your time wisely. So, make sure you do submit your assessments on time, take note of all the deadlines and stuff. But yeah, it really helps that if you can manage your time wisely, because the units, they're not really heavy. Like it's well organized, like the timing and schedules and everything. But yeah, like with my research here, it's just a total of like 8-9 months to work on your research project. So you should be able to know how to manage your time wisely, like when make sure you know when you're gonna be submitting your theses and stuff, and like schedule your experiments on time to meet the deadlines.
Thank you, Yvonne. We will be concluding the session shortly. So if you have further questions, please feel free to send an email to an email address that I'll put in the chat shortly. So thank you everyone once again for joining us this evening, and we look forward to seeing you in the course, hopefully in 2025. All right, thanks everyone.
Thank
Have
you.
a good night.
All the
Thank
best.
you.
Bye.
Thank you. Bye.